Hello and welcome back to Health with Sveta. I'm Dr. Sveta Silverman, and today's episode is one. Not only I'm genuinely excited, I am just jumping out of my chair. I am so stoked, guys. Joining me is a friend of mine, is a business partner of mine, is a colleague of mine, amazing Dr. Melody Rodarte, a practicing physician based in Scottsdale, Arizona, specializing in bariatric medicine and functional medicine and a whole lot more. We will talk about it. She has been voted to be the best doctor in Phoenix for the last 7 years. And she brings both clinical expertise and entrepreneurial insight to the conversation. Beyond her professional accomplishments, she's a wife and a mother of twins. In this episode, we are trying to talk about something that impacts millions of people, their wellness. Their wellness in terms of physical and financial state. We are going to be talking about obesity and how it has become the most prevalent in Western society. This is going to be a powerful conversation about responsibility, longevity, redefining what it means to lead in healthcare and how to lead our lives. So thank you, Dr. Melody Rodarte. Thank you for honoring me. Thank you, Melody.
Thank you, Dr. Sveta. I absolutely love and adore you. I love that we are colleagues and friends. And I'm just going to say I'm one of the best obesity medicine docs. I'm not number one.
Oh, you're just quite humble. We've been there. We know that. So thank you. But thank you. So, seriously, thank you for honoring us. So being one of the best for 7 years, it just tells me something. I'm pretty sure that this is an independent, non-biased voting. And I'm pretty sure living in Phoenix, basically living in Arizona and practicing in Scottsdale, there are a lot of kind of quote to quote, a lot of you. People who are physicians of different kinds who are jumping on the trend. So, and before we are going to jump on the trend, because that trend is actually an essence of our lives, of our longevity. Let me ask you a question. How did it evolve into bariatric medicine? Because you don't strike me as you guys, this is an audio podcast. You do not see how fit she is, how dedicated she actually is, not only to her appearance, to her body. So, how did it evolve into bariatric medicine?
You know, it started from the beginning. I've always loved health and nutrition, and I always wanted to be a physician. And as I got into medicine, I noticed that it really made a difference how people took care of their bodies, what they ate, how they would age. And my first practice was actually the average age was about 85, and I saw it was too late for them. They didn't really want to make any changes. Here in Arizona, we have a lot of what we call snowbirds, and people who like to winter here. Yes, because they don't like the cold. Well, if you think about it, where I was in East Mesa, these patients, they would even come from Canada, go figure, but they would want their health care here in the States. And then those who were also from, let's say, the East Coast or colder climates, they would come here because it would be easier for them to rehab from their surgeries. And so they would choose physicians in Arizona to have. And I noticed that at that time I was starting to do wound care and hyperbaric medicine. Nutrition really mattered, how they healed. My patients who were not as overweight or obese, when their diabetes, was more controlled, they would heal better. They had better surgical outcomes. And so I felt it was more important for me to really dive into that with my patients, where it was a way of life for me. But now I saw the bigger importance of really teaching my patients it. And I came out of medicine in 2005, 2006, and that's when we started to see a lot of changes with weight coming on, nutritional changes, I really feel. And I saw bariatric medicine taking off. And I wanted to be at the forefront of that with how to teach people how to lose weight and prepare themselves before they chose bariatric surgery, if that's where they were going, and how to continue it. Because I knew that if they thought it was a quick fix and only have surgery, they would fail later on as well. You have to have the basics. You have to have the cornerstone built before you do anything, aggressive.
That is, you just nailed a few things. So, even before we get into the quick fixes, I love how you said no quick fixes. Commitment. Why obesity and metabolic syndrome is probably one of the most frequent conditions in Western society, especially in North America. Why?
Because, and I love that you do root cause, you understand root cause medicine now with doing your fellowship, and you get to see the cell at that cellular level. You can tell if someone's inflamed or not, their cells. And I believe the way that we live now in an environment that is more toxic has really allowed obesity to take off. So I think we don't exercise as much. We took exercise out of school. I had to do PE when I was in school. Not all schools have physical education PE anymore. Like, I was outside all the time. Yes, video games were present, but you had to go outside and ride your bike. I had to ride my bike to school. The activity level was there. Nutrition.
Maybe that's why your daughter is a champion in badminton.
Yeah, activity is so important. I think they make friendships that way too. It's just so it teaches them life skills. And then our food has changed. I remember begging my mom if I could have a white bread sandwich with the cheese that came in a wrapper, because everybody else was having that at school at times. And I was bringing food where they thought my parents were poisoning me, because I'm first generation born. My parents immigrated from Lebanon. So back then I already was eating the Mediterranean diet. But our food has really changed. So much is processed. People are on the run. It was like a treat to go out to a fast food restaurant, not a normalcy, to do back then, if you think about it. So, and then, I don't know how political we want to get, but sugar is in everything in the United States. And we're allowed to really change the ingredient profile of food. And I believe that has led to obesity as well, because we're just having nutrient deficient food instead of nutrient dense food. And then the medications, people they seek to be on medications before they want to treat anything. So certain medications can lead to weight gain. They promote weight gain. And so, yeah, I think those are just some of the key factors that I think is leading to our epidemic.
Let me ask you a question, because you just brought it up, sugar and stuff. Because sugar is different from a sugar and stuff, and especially in the light of recent events and sort of the new American fight on ultra processed foods. And as we know, ultra processed foods is the refined sugar. So, as a physician, why refined carbohydrates or that refined sugar is so detrimental for our waistline and more? Why? What happens? Why, when I eat the wheat berries, for example, is different than I eat wheat cookies?
Right. Think about the process in which it undertook, that wheat berry had to undergo to become the cookie. You're stripping it away and pulverizing it into different nutritional parts. And then you're bleaching it, and you're adding sugars, and you're adding other preservatives because you want the shelf stability, you want taste.
So
And
you just nailed it. Sorry, interrupting,
yeah,
but this is I'm jumping in because you said we're bleaching, toxins,
yes.
we're shelving, preservation and stuff, preservatives, toxins. And you said we're stripping, let's say, the whole wheat berry, we were talking wheat, for example. You're stripping it from something that is, yes, irregardless, the wheat berry eventually is going to transfer into glucose, into that carbohydrate, but it will take hours and on and on. And let's say that husk and all that stuff that is going to bring fiber, and it is going to sort of, balance the time of digestion and the ability of absorption minus those toxicities. So you just absolutely nailed it. And the thing is, isn't this the cumulative effect and the addictive effect? The problem is, again, now I'm sort of jumping on board, is that those processed sugars, those fast sugars that absorb so fast. So then what happens is, it's your world of bariatric medicine.
Yeah.
Let's say we get the insulin on board, then that insulin, rush of insulin, then it going to dissolve or would do something with those sugars. And then because you just ate, but you're hungry. But you're hungry again, as opposed to when you're slowly breaking it down and slowly digesting and absorbing it, it sustains. It's like, yeah, my stomach is full. It's not empty.
Yeah, it's so true. It's so true. I love to share the examples with my patients about if they were to drink apple juice or eat an apple. That's one of the examples. How full would you feel? For that cup of apple juice, there's probably 5 or 6 apples in that. If I were to put 5 or 6 apples in front of you, you would have a hard time eating all of that. And so the digestive part of having the fiber and the pulp and chewing through it, that takes time, and you're not going to be able to eat more than one apple most likely. But the apple juice, for sure, you could drink that down in a second, and then you might be full for about 5 minutes, 10 minutes, 30 minutes. And then again, you're going to be like, oh my goodness, why am I so hungry again? And that happens too when I love the example of, I live in Arizona. There's lots of Mexican food here. When people they sit down and they eat their chips and salsa, they will devour, 2 or 3, bowls of it, barely then eat their dinner because they are so full on chips and salsa. And yet an hour later be ravenous, and why I could barely, walk out of the restaurant. Why am I this hungry? And it's just because when they started with those tortilla chips, it is in its refined, it's processed down, it's in that simple glucose, so your insulin went skyrocketed up. You barely ate any of maybe the proteins that were in there, and maybe you had other carbohydrates like the rice and tortillas and whatnot. So then your insulin made all of your cells hurry up and do something with the carbohydrates. And since you're not active, it's going to store it as fat. It's going to store it, and you're going to be hungry again.
You just said it. Then you're basically into the vicious circle of obesity, because you're not eating fats. You're eating carbs.
Right.
But you're becoming obese or something like that. Now, let me ask you another question. Why is too much insulin not so good for you?
Insulin resistance leads to inflammation, chronic inflammation, and insulin resistance is not a good thing, because then you're having down regulation in your body to respond to insulin, and so they'll have higher and higher levels that are happening, and it becomes a whole vicious cycle as well. So, and I think what we also are forgetting about is just a well-rounded meal. A lot of people listening to this at first might think that I might be blaming just, food and exercise, but there is part of the package. I don't want anyone to walk away from here thinking they need to exercise more and eat less. That might be part of it, but it's not the whole picture. And so eating correctly for one's anatomy and movement are just key here so that everything else, like dominoes, they go down in the correct manner.
The high insulin is not good because, as a pathologist, insulin is what it's called a growth factor. It's a growth factor, so it is contributing to the growth. What is it? It's contributing on a bad milieu. It's contributing to the growth and development of bad cells. I'm sure you understand where I'm leaning.
I do.
Yeah, of course. Because as a cancer doctor, the main thing for me is how do I help? How do I educate masses to start living right? Because my and your mantra, I'm pretty sure, is the same. The prevention is the best cure of the disease.
Yes.
And the key, in my mind, the cure of cancer is the prevention of it.
Yes.
Then we do need to commit and dedicate ourselves and insulin control with insulin resistance is one of this because again, now insulin resistance. So the cells are resisting to insulin. What does that mean? It means in my world that the cells are not getting nourishment. That's a whole thing, that there's plenty of glucose in the bloodstream, but the insulin does not allow. The cells are so fed up with everything that's going on, they're not allowing those insulin gates to let the glucose into the cells. So the cells, you have plenty of glucose on board in your bloodstream. Your sugars are high, your insulin level in the blood is high, but your cells are starving. When the cells are starving, you get a signals into your brain, I'm hungry, I want more and more and more. And that's a vicious circle, and that's a vicious circle. And that's exactly what Melody said. It is our commitment to the foods and to the exercise. So the exercise, so what do you recommend to your patients as the exercise routine?
Movement every day. And I want them to find movement that they like. So,
Awesome.
like, yeah, for me, if someone told me to go run, I'm going to say, no way. I hate running, but I will go for a brisk walk. I will work out. I like tennis, find movement.
Exactly. You're so right. One of my mentors, Dr. Pamela Smith, who chairs the fellowship, she doesn't like to run. So she said, no, her gig is ballroom dancing. Whatever makes you happy to exercise. If you don't like, I mean, I know that I need to do yoga, but sorry, I don't particularly like this. I'm Russian type A personality. I need like something moving. Whatever needs, you need to find your niches, as you said. If you like to play tennis, pickleball, whatever, walk with the dog, you just got to move.
And you need to move throughout the day. So we have so many new studies showing that even doing a half an hour of exercise and then having a sedentary job, the rest and not moving much the rest of the day almost negates that 30 minutes you did in the morning. So do the 30 minutes in the morning or the 30 minutes in the evening, but throughout the day, go for short little walks, take the stairs, do squats. There's just key parts.
Let me ask you a question. So you have a very obese patient that walks into your clinic and stuff. So you obviously cannot tell him or her to start running 30 minutes a day. So how do you start them? How do you encourage people to do things so they're not leaving your office and said, okay, I'm not coming back?
I love that you gave me that question. A lot of them might need a physical therapist at first just to get them to safely move because they can't even tie their shoes, or get up out of a chair properly. And so I'll use physical therapists. I also have trainers that are specialized in training patients with obesity as well. And so it's a very safe manner for them to exercise. But the biggest thing is I will get them to walk. And I'm in Arizona. I will see if they can walk in water because the lack of gravity in water helps their joints not hurt because of the weight. And so I'll ask for 5 or 10 minutes of walking once or twice a day. We'll maybe just start there or little resistant bands that they can start. So we find something where it feels like they can move without it being too much of a homework, or and we don't want them to hurt them.
Exactly, exactly. They need to enjoy it. So let me ask you a question. So, okay, fine. So, movement. How do you approach the foods? Because some of them are so stuck on this packaging.
So I do carry meal replacements in my office because some people just need to have meal replacements. I try to use ones that have real sugars instead of fake sugars. So things like sucralose, or I try to avoid. Do I have some patients do it? Yes, because nutrition at that point is, how do I reduce their caloric intake safely where they can feel full? So I will use meal replacements with some of my patients, especially if I need to get them to surgery, like a knee replacement, a hip replacement, something, maybe even needing to have a heart procedure that they're just too overweight to undergo yet. And then I move them to Whole Foods as soon as possible, and helping them choose how to grocery shop. I even have some nutritionists. I have a health coach in my office. How do we put a meal together? How do you make more than one meal out of certain, if you did a pot of quinoa and you shredded a chicken and you bought different root vegetables, how do you put it together so it's not the chicken and broccoli every single day kind of thing?
Let me ask you a question because obviously people, oh, I can't afford organic. What's your concept on this thing? Because it's like, I'll tell you sort of my concept. Honestly, I don't care. I mean, I do care, but I don't care. As long as you put whole foods, what is your take? How do you teach them the concept that you got to eat and the notion I can't afford it
Yeah.
that
So
exists? So we
we
need
just
to
start, yeah. We start low. Like, can you just pick out, like, I'll show them how to look up the dirty dozen. And I ask them, can you maybe do organic on these items? Because these are on the dirty dozen list, like berries, or maybe we'll do them frozen because organic frozen is cheaper than organic fresh. So I like to just say it's not an all or none. What small changes that can we do to add up to bigger changes?
Awesome. You just nailed it. You said, guys, she did not tell you drop everything and nope, you're going to eat whole foods, boom, fruits and veggies, all organic, and free range meats and free range eggs. Well, she just told you this is how you start consistency and responsibility, slow changes, because then you are sustaining it. I really do not. I'm sure Melody probably the same. I don't like when people lose 10, 20 pounds in a week. No, I am very comfortable when people go half a pound or something and it's consistent. They are changing their routines and they're sustaining that routine. Is that what you do as well?
Yes. I can expect that 10 to 12 pounds a week if I have a true bariatric patient who's starting with me at 500 pounds. Then I can expect that because a lot of it is water weight initially. But for those of us, it's a half a pound to eat a pound, even up to 2 pounds a week is safe, because what we don't want to do is lose muscle. And that's what we're seeing. We're seeing so much more muscle loss because of how quickly people are losing weight and they're not doing it correctly with nutrition on board.
Or we'll get to GLP-1. So the thing is, you just absolutely, guys, sustaining muscle mass is absolutely critical because especially for, I mean, males and females in menopause or menopause, when we start losing those sex hormones naturally via natural aging, that leads to losing muscular mass. Muscular mass is critical for anti-aging. So, and that's exactly what Melody said, because yes, The next topic is going to be, we're going to talk about GLP-1. Why is this the most favorite kid in the block? And some of the drugs, they cause you to lose muscle and not to lose fat. So it's very important when we start eating correct or trending to start eating correctly. That is why it's so critically important to exercise and sustain and actually build the muscles. Very, very important.
Let's take a quick break to talk about some tangible steps you can take right now towards true health and happiness. My life's purpose is to empower you to seize control of your life, especially when it comes to wellness. But every person's needs are unique, and there is no one-size-fits-all solution. That's why we're launching a brand new initiative. Now, you can book one-on-one call with me, Dr. Sveta Silverman. Please do. Together, we'll talk about your history, your health history, how you feel, how can you improve on your health, the goals. I'll use that information to help you to plan a custom approach full of recommendations that I learned not only from my medical career, but from my personal journey. Let's unlock the secrets of happier, healthier you. Visit healthwithsveta.com/contact to book your free 30 minutes conversation and call with me. Now back to the episode.
So now, okay, let's go into the kid in the block. Let's talk about GLP-1. What's a GLP-1? Why is everybody on it?
Oh man, it is the new kid on the block, but so many people don't even know that they started early, like 2011, 2012. They were diabetic medications, the first generation of GLP-1s. And they were good at helping people get their A1C down, but they were not very good at weight loss. And some of them were daily injections, some were weekly injections. And when the newer generation started, and everybody knows the name Ozempic, they started noticing the weight loss that happened. And they noticed even more than that, because the previous generation still showed that it reduced inflammation, but they didn't really fully, I feel, understand that. If you look, there's some papers in 2015, 2016 talking about GLP-1 reducing inflammation. But what we've really noticed in the past 5 years with Ozempic and Mounjaro, or if we want to use, the generic name semaglutide and tirzepatide, is just not only weight loss, but reduction in inflammation. And so that's why they're getting approved for, let's say, sleep apnea, non-alcoholic fatty liver disease, cardiovascular disease, because we have a GLP-1 receptor on all of our cells. And what you mentioned earlier is insulin resistance causes inflammation of the cells. So if we can really, hone in and reduce that insulin surge, people are not eating as much, so they're not getting the carbohydrate surge. You're not having as much inflammation. There's I'm hopefully connecting the dots for everybody here, but they're incredible tools. They're incredible at diabetic control, weight loss, and more.
Yes. Now, you mentioned, let's say, the generic names, tirzepatide, all that stuff. And what are, I'm just going to touch upon it because all of them are another kid in a block. They're called peptides.
Yes.
So it's like, and I know that you are highly trained and certified in peptides. What is the buzz about peptides? What is the peptides? Why? Because, insulin is a peptide, by the way.
I was going to say insulin is a peptide.
Insulin is a peptide. So what is the buzz about peptides?
If we can increase peptides naturally, so we release GLP-1 naturally from our gut, from our L cells.
Okay, now, stop. Before that, so we release GLP-1 from our gut, from L cells. Now, what feeds the L cells?
nutrition and probiotics and
And from
fiber.
what? From microgut, correct?
Yeah.
Exactly. So the next, yet before, so I'm sort of, because I'm afraid that I'm going to sort of, miss that thing before we get on peptides, the importance of microgut. So basically, I think I'm going to make a very bold statement. Every obese patient has a deficient microgut.
I would agree with that.
So the importance. So now let's tell the listeners, what do we mean by microgut?
Yeah, so our microgut is where so honestly, we have from our mouth to our bottom is a tube. And yep, and that it starts, like digestion starts in the mouth. You have enzymes that are secreted and that are telling your stomach and your pancreas, they're preparing your body to digest, and certain enzymes are released. And these probiotics, these are little microorganisms that are in there. They really are telling that lining of the gut what to do. And so they are absorbing our nutrition. They are converting. That's where things are converted to. So for absorption, that's where you need those micronutrients there to stimulate messages. That's why we call it the gut brain axis as well. It's telling our body what is happening. And so nutrition and food is code to what is happening, but we need a healthy microbiome, which are probiotics, bacteria, good guys. And there's all kinds there. They're in, you need them to be in balance. You also need secretory factors. There's such a milieu. I mean, we could spend an hour talking about
That's
what
right. It's just amazing. It's evolving.
it evolves. But I think as a whole, the tip of the iceberg is we have good guys in our gut that really need to be healthy in order for signaling to occur properly. You don't want a leaky gut.
Yeah. Exactly. But unfortunately, when you eat the processed, ultra processed food, you actually shift to bad guys, to bad
Yes.
bugs. You disturb the equilibrium. Unfortunately or fortunately, the bad bugs are stimulated and fed by the proper whole foods, by that Mediterranean diet that Melody was talking about from the beginning and in the beginning of the podcast. And then those bugs, that's a whole thing, guys. Sometimes we need to realize we actually run by our gut.
Yeah.
In many, many ways, in ways of immune system, in ways of neuronal system, nervous system, autonomic nervous system. So, and those bugs, not only they run us, but they feed those L cells. So those bugs, when we feed them right, so then they produce something that is called short chain fatty acids and stuff. They feed those L cells to make those GLP-1, those peptides. So now let's go back into peptides.
So peptides there, I mean, it's another whole discussion, but so we can synthetically make a peptide like semaglutide or tirzepatide, or we can naturally increase those peptides in our body like GLP-1, PYY, so many more. And so it's the health, and that's what I want your listeners to really understand is when they have proper nutrition and if they do need to take this in either the natural or the synthetic way, it's going to work better. And so I believe that obesity is a chronic disease. And so they need to think of this and understand that it's for those who have struggled with their weight for so long. GLP-1 is probably something they will always be on. Does it necessarily mean that they're going to have to be on it every week in the maximum dose? No, just like everybody else, when they lose weight, I can reduce their blood pressure medication, their cholesterol medication, and everything else. But I truly believe that this is something that is helping what they are lacking in helping their body not want to gain weight and stay at a lower weight. But for those of us who might be going through menopause, perimenopause, figured out that, oh my gosh, my life is, dedicated to work and I need to change that, and they're changing everything, they might just need a GLP-1 for a short period of time. But they need to be using it in a correct manner And they may do well with a natural GLP-1 activator as well. And there are several on the market. And when someone goes, "Oh, I heard acromantia is wonderful, I'll just take that." They're just you can't plug. And yep, it doesn't work that way. I
It
love your
doesn't work
face.
that way because, yeah, you overdose your acromantia and you're in trouble. Everything has to be in the balance. And when, let's say, physicians like Dr. Rodarte, they start adjusting the cellular metabolism with appropriate GLP-1, for example, whether it's natural or it's a synthetic, that's a different conversation. But with a proper lifestyle that Melody brings, and that she adjusts all those blood components, because she looks at the blood, she looks at the urine, she looks at the stool, she looks at a whole bunch of things, she looks at biochemistry of the blood, all these components, micronutrients. That's when all this equilibrium and all this balance comes on board. There is no such thing as a pill. There is a pill for every ill. It doesn't work. What works is exactly what Melody, Dr. Rodarte, is doing in her practice. She's putting patients in those wheels of the education to the proper lifestyle, because we need to get from the metaflammation, from metabolic inflammation, and from inflammaging, from inflammation and aging into proper biologic aging, proper healthy, vibrant living. And that's what we are going to address in the next episode of the podcast. So, Dr. Rodarte, thank you so very much for joining me and joining us on the podcast Health with Sveta.
Thank you so much for having me.
Thank you. Today's conversation reminds us that health is not accidental. It is consistent, contiguous, and it is commitment. And it has to be also well informed. And that's why we absolutely need physicians like Dr. Rodarte. Guys, Dr. Rodarte is an absolute pioneer. There's no ways around it. And that pioneer is also pioneering more and more, because she's never at the end of it. She's always at the frontier, attending more and more courses. So again, thank you very much, Melody. It was a joy, a delight. And I need to tell you that, thank you, listeners. But I need to tell you that I absolutely love Dr. Rodarte. Love you, my friend.
Love you too.